San Diego Made, San Diego Proud. I'm Carrie Lane, and we are celebrating business members who have helped define San Diego as America's finest city. With me this morning is Dr. Julie Ellner from Alvarado Hospital. Good morning.
Good morning.
So we're talking about weight loss, and I think a lot of our viewers at home can relate to this. At some point, people have tried to shed those few pounds that they don't want. Diet and exercise are usually the first things people turn to, but it doesn't work for everyone, and you have some other options that people may not be aware of, and a wonderful seminar to help educate our public.
That's right. For a lot of people who have to lose maybe 50 or 60 or more pounds, they've really found that the diets don't work. The diets fail in 97% of patients with serious amounts of weight to lose. And it's for those patients that surgery comes into the picture as an option for helping them lose the weight, but also helping them lose the medical problems that go along with weight.
So when is the seminar?
It's a week from today on the 24th at 6 p.m. at Alvarado Hospital.
And it'll educate, give you all your options, and basically help you find the best fit for you, correct?
That's right. It's a great way to go to an informal seminar, just get some information. A lot of people haven't really done a lot of research into obesity surgery, so they just sit in the back and soak up the information. And other people have done months or years of research, and they sit right in the front and pepper me with questions all night. But we also have a couple of really lovely patients who have had surgery who come to the seminars to answer more personal questions from people who want to do that.
I think it's always good to be able to talk to somebody who's been through it. Now, we have a couple of success stories, and we have some pictures to go along with it. Tell us who you have for us.
Jody's one of the first patients. She's an absolutely lovely young lady who came to me at about age 26, and she had a lot of medical problems. She was fairly sick for such a young lady, but one of the main motivating factors for her was that she was infertile because of her weight. So when she had the surgery, she lost almost 200 pounds. She's absolutely beautiful.
The picture, the difference is incredible.
She's amazing. And she called me about a year after her surgery on my cell phone to say, Dr. Ellner, I'm pregnant. And that's really what she wanted to get out of the surgery, was to have a pregnancy. And she's had two beautiful young boys now at this point. So I think she would probably say that that's the neatest thing about her entire weight loss experience. Now, Michael is one of the other patients who will be at the seminar. And he had a list of medical problems as long as your arm. He was a fairly sick guy, and his weight was slowing down his ability to run his construction business. But what really motivated him at the end of the day to have surgery was his little boy. He just wanted to lose weight to be a more active, better dad. So now he's almost 200 pounds lighter. He's a very active dad. He has a great relationship with his son. And his business has actually been booming because now he's more active and he has a lot more energy. So it's worked out for him.
And one thing we were talking about too before we went on is, you know, diet is obviously, it's good to start with the diet and the exercise, but is it just as safe to do the surgeries? And you said sometimes being overweight actually is more dangerous than what you could suffer from the surgery.
That's right. A lot of people try for years or decades to lose weight with diet and exercise because they're perhaps afraid of potential complications with surgery, but when it really comes down to it, for people with serious amounts of weight to lose, obesity will kill people. And it's almost 10 times more likely that a patient would die from obesity than to die from the surgery.
Real quick, again, when is that seminar if people want to join?
It's on the 24th at 6 p.m. at Alvarado Hospital.
Only female doctor in town. Ladies, if you want a female to help you out, it's always nice to have someone of the same gender sometimes, especially with topics that are not as comfortable.
That's right.
Thank you, Dr. Ellner, for sharing all this with us.
Thanks for having me.
And you'll be at the seminar yourself?
I will be giving the seminar myself.
Perfect. All right, we'll see you there.
Thanks.
Thank you. That's a look at today's San Diego Made, San Diego Proud. We'll see you next time.